Hello, my dear DOTT students. ಬಾಬು ಸಿಂಗ್ ಠಾಕೂರ್ ಪ್ಯಾರಾಮೆಡಿಕಲ್ ಕಾಲೇಜ್. ನಾನು ಡಾಕ್ಟರ್ ವಿಜಯಲಕ್ಷ್ಮಿ. 5 ಮಾರ್ಕ್ಸಿಗೆ ಸೆಪ್ಸಿಸ್ ಅಂತ ಕ್ವಶನ್ ಬಂದಾಗ ಯಾವ ರೀತಿ ನೀವು ಆನ್ಸರ್ ಬರಿಬೇಕು ಅನ್ನೋದನ್ನು ಇಲ್ಲಿ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿದ್ದೇನೆ, ತಾವೆಲ್ಲ ತಿಳ್ಕೋಬೇಕು. ವಿಚ್ ನೋ ಲಿವಿಂಗ್ ಡಿಸೀಸ್ ಕಾಸಿಂಗ್ ಮೈಕ್ರೋ ಆರ್ಗ್ಯಾನಿಸಮ್ಸ್ ಆರ್ ಪ್ರೆಸೆಂಟ್. Asepsis covers all those procedures which are performed in the hospital, even biopsy, operation, small dressing procedure also you have to use the aseptic precaution. Asepsis means to clean the microorganisms. Then to contamination instruments also, using sterile instruments, sterile draping, sterile gloves. This is the asepsis. There are 2 types of asepsis: medical asepsis, surgical asepsis. Medical asepsis means to clean, to prevent when you are practicing, that kill some of the microorganisms to prevent them from spreading one person to another person. What is surgical asepsis? Surgical asepsis means to sterile the things, equipments and practice that completely kill and eliminate the microorganisms. Purpose of asepsis: to remove the resistant bacteria from fingers, hands, forearm, to prevent the risk of transmission of infection to patient, to reduce the risk of transmission of infection organisms to oneself, to prevent cross infection among plant. Microorganisms are exist everywhere, exception sterilized equipments. Frequent hand washing and maintaining intact skin reduce transmission of microorganisms. Body fluids, cells and tissues are the major reservoir of microorganisms. Personal protective equipments serve as a barrier to microbial. Principles of medical asepsis: all body fluids from any patient is considered contaminated. The healthcare team and the environment can be a source of contamination for the patient. Assess each patient to determine he has an infectious process. Choose the barrier appropriate to the infectious process. Isolate the disease, not the patient. The clean is as strong as the weakest link. Principles of surgical asepsis: sterile drapes are used to create a sterile field. All items used in sterile field must be sterile. In the operation theatre, dressing materials and any biopsy or any other diagnostic procedures. All items introduced onto a sterile field should be opened and dispensed and transferred. Principles of surgery asepsis: sterile drapes are used to create a sterile field. All items used in sterile field must be steriled only. All items introduced onto a sterile field should be opened, dispensed and transferred by methods that maintain the sterility and a sterile field should be maintained and monitored constantly. Surgical staff should be trained to recognize when they have broken techniques and should know how to remedy the situations. Touching one sterile item with another sterile item. Touching one sterile item with non-sterile item. Partially unwarped sterile package is contaminated. Partially unwarped sterile package is contaminated. If a question arises about sterility, it is contaminated. A commercially packaged sterile item is not considered sterile past. It's recommended, and expiry date also you have to see. Once a sterile item is opened, it is only a matter of time and before it becomes contaminated. That setup should be immediately before using. A sterile warper, if it becomes wet, microorganisms form its supporting surface, causing and contamination. It is very easy to remember difference between medical and surgical asepsis. Medical kill the microbes on living bodies. Surgical means kill microorganisms before entering the body. Cleaning technique and sterile technique. Prevent transmission necessary for invasive procedure. Non-invasive procedures and sterile scrub hand washing and sterile gloves. Clean field and sterile field. Protects health of patient and health workers. Protect